Welcome to Experience Army Medicine Interviews. Our mission is to interview local medical professionals within the Army so they can detail their impact in medicine today.
So it's Lindsay Felker, and I am a 66 Whiskey, which is a certified nurse midwife. So I was a labor and delivery nurse, or 66G, in the Army for about 14 years. I was kind of stepping into that provider role of really wanting to go outside of the nursing care plan and really focus on empowering patients to make decisions and using informed consent. And being a midwife and a nurse practitioner was really that next step for me. The definition of midwifery is being with women, and that just really resonated with me. It means we can take care of women from menarche to menopause, and so it's not just the inpatient side of being with a woman in labor. It really encompasses the entire childbearing years of a woman, and so being able to really be that advocate and be that educator and to help assist women with whatever their goals are and be a part of their care is just such an honor. And so that to me was just a message that really spoke, and that was my next step as a nurse. So my new role is now I'm the Chief of Maternal Child Health here at Madigan. So huge honor. I actually get to be a leader and a mentor for our potential midwives and our 66Gs as well as our civilians. And I also have an expanded role working with mother-baby, NICU, pediatrics, and the pediatric intensive care unit. So I have that honor and that privilege to serve the nursing population on that administrative role, but I'm still in practice. So right now I'm currently working with fertility patients. So I've expanded my scope here to be able to work with that population. And so that's been quite a joy and actually a really big challenge because it's a new subset of patients. And then I'm still taking call as well, working on labor and delivery and working with the birthing patients as well. So I kind of have a mix. I'm doing administrative, I'm doing some patient care in the clinic, outpatient and inpatient. So there's not a day that I know what's going to happen when I walk in. It's different every single day. It's a lot of administratively putting out fires and just being present as a leader. I find that that's a huge part of being present for those future leaders because it's, I'm getting close to retirement, and so it's about bringing up the next generation. It's not about me anymore, it's about them and really giving them that space to grow and become who they are going to be the future of the Army. Number one, the passion. We wouldn't be in this job if we didn't love it. And so how lucky am I? I think if you look at it like that, it's something we have to go to a lot of schooling for. And so if it wasn't the right choice for us, I don't think any of us would be there. And so how much of it is our honor to be there, right? To witness your amazing event. Oh my gosh, what an amazing event. And then I think it goes back to nursing. If it's a specialized area and it takes an individual that has passion for it, that sees the power of what a woman can do and what she is capable of, what they are able to do as a couple, whoever that couple is, what an amazing space that is to be invited into. And to just be a small part of that and see them reach whatever goals that they have for their birth and after, just that power, I get chills thinking about that. I think that's where the passion and that's where the compassion and empathy comes from, is just that honoring that space. Not easy. It's a choice you make every day to join the military. It is a freaking choice you make every day to wake up and join. And have I put my paperwork in 3 times to get out of the U.S. Army? Absolutely. Have I pulled it back though? Because the Army has put something on my plate that has been worth it. And I've never said no. Never say no to any role, whether you want, whether it's your heart or not, right? Because you never know who you're going to impact in the future. Number 2, don't forget where you came from. Because as a senior leader, if you forget where you came from, you're not going to lead the right space and you're not going to lead the right way. And so if you forget the floor nurses, you forget, you're not going to impact them the right way. And we're not going to mentor and lead, and we're going to continue to lose people. We're going to continue to have that recruiting mission not met. And 3, know when you're done. Know when you're done. Know when it's not your space. Because if it's not your space, that's okay. Because continuing on, the Army will continue on beyond you. And like I said earlier, for me now, it's about training up I mean, I've got them on my board now. I've got all my lieutenants and my captains it's time to bring them up. It's not about me anymore.
Thank you for listening in on our Experience Army Medicine interviews. We hope that these interviews help encourage your own path into a healthcare career. If you enjoyed the interview, please don't forget to like, follow, and share our content as we continue to dive deeper into Army Medicine. Be all you can be Army Medicine.